When a child gets a rash on the hands and feet, parents often think it is allergy or chickenpox or measles, but in many cases, it is hand, foot, and mouth disease. Hand, foot, and mouth disease is highly contagious viral infection, usually caused by Coxsackievirus. It most commonly affects children under 10 and causes fever, painful mouth ulcers, and rash on the hands and feet. Outbreaks usually occur at the end of summer and early autumn because the virus survives well in warm, humid climates. The disease usually starts with fever, sore throat, irritability, and poor appetite. The hallmark sign is painful blisters, vesicles on the tongue, gum, and inside the cheeks, and a red skin rash with blisters on the palms, soles, and buttocks. The illness typically lasts 7 to 10 days and is mild in most children. Oral ulcers are especially painful. Gray vesicles appear inside the mouth, while blisters like non-itchy lesions form on the hands and feet. In some cases, children lose their nails weeks later, a harmless condition called onychomedesis. Adults also can get it, but usually with mild flu-like illness, because immunity is partial, not absolute. That's why adults often have no rash, but they remain contagious. In pregnancy, hand, foot, and mouth disease is also usually mild, but if the infection occurs near delivery, the virus can pass to the newborn. In rare cases, it causes neonatal sepsis-like illness. This disease is caused by enteroviruses, mainly Coxsackievirus A16, Coxsackievirus B, and enterovirus 71. The virus enters the body through the oral or respiratory route. First replicates it in the throat or intestines, then spread via blood to the skin, mucous membranes, and sometimes to the brain and heart. That's why, although usually mild, it can rarely cause meningitis or myocarditis. The main risk factor for Coxsackievirus is poor hygiene, contaminated water, and crowded areas like schools and daycares. One important problem with Coxsackievirus B is that it can directly infect the heart muscle and cause inflammation, necrosis, and dangerous arrhythmias. The risk is high in newborn, infants, and people with weakened immunity. That's why in these groups, this disease can progress to sudden heart failure. Warning signs include chest pain, pressure, shortness of breath, palpitations, fainting, and in infants, very poor feeding. Another strain, enterovirus 71, can cause meningitis and encephalitis because it is neurotropic and crosses the blood-brain barrier. This complication is rare but reported especially in Asia, and warning signs include severe headache, neck stiffness, repeated vomiting not explained by fever alone, seizures, confusions, and drowsiness. Differential diagnosis is important because this disease, hand, foot, and mouth disease, often confused with other illnesses. For example, with chickenpox spreads over the body, but this disease lesions are localized on palms, soles, and mouth. Measles and rubella. In this case, rashes start on the face and spreads down, unlike hand, foot, and mouth disease. In case of allergic rash, there is no fever, no mouth ulcers. In aphthous ulcers, there is only mouth, no hand, foot rash. In herb angina, ulcers in throat but no skin rash. In scarlet fever, rash is sandpaper-like, and in HFMD, there is a rash, has vesicles. If we say about treatment, there is no approved direct antiviral drug. Preconaril showed benefits in trials, but it's not approved. So treatment is supportive. For fever and pain, paracetamol or acetaminophen in every 6 hours, or ibuprofen, which is used in children after 6 months. It reduces pain and improves hydration because child starts feeding better. For mouth ulcers, lidocaine 2% gel only in children after 2. Benzidamine spray or rinse because of its anti-inflammatory action. Sucralfate, it coats and protects mucosa. This reduces pain and improves eating. For skin rash, usually no treatment. Zinc oxide cream has barrier and drying function. Calamine lotion, soothing function, and hydrocortisone if person has severe itching. Oral hygiene is key. Gentle brushing and saline rinses help. They reduce secondary bacterial infection. Hydration is crucial. Cold milk, yogurt, ice pops, smoothies help. And avoid citrus and acid foods, which worsens ulcer pain. If myocarditis develops, hospitalization is required and ICU monitoring, oxygen, careful fluids, and antiarrhythmic drugs and intravenous immunoglobulins may be required because it can neutralize viruses. If there is meningitis or encephalitis, hospital admission is crucial. That's this case also. Supportive care and sometimes intravenous immunoglobulins. From prevention, hand washing is strongest preventive tool because the virus spread via stool, saliva, and blisters. Good hygiene can cut risk by more than 50%. Children should stay at home for at least 7 days after onset. Disinfection of toys, surfaces, and avoiding swimming pools during outbreaks is important. HFMD is usually mild, but can rarely attack the heart and brain. It mimics other rashes, spreads rapidly in schools, and has no specific cure.